Hello and welcome to CGTN live coverage on the mission of transporting 50 infected patients to Huoshenshan Hospital, which was newly constructed and was taken over by the People's Liberation Army on Sunday morning. And today is a very big mission that in total 10 ambulances are going to take 50 mildly infected patients from different hospitals across the city of Wuhan to Huoshenshan Hospital. It's a very big mission. They are going to be the very first batch of patients that will be taken in by Huoshenshan Hospital, right? Communication. Now we're back again because of the communication thing. We're on a moving car, so it might be not quite stable for the communication. Now we have with us right now in the ambulance, in the van, Dr. Jin from Wuhan's Emergency Medical Center, and she is going to help with transporting those infected patients from the center hospital of Wuhan to Huoshenshan Hospital. And she is one of those who have been having a very close contact with those mildly and severely infected patients. Thank you very much for joining us on the show, Dr. Jin. 非常感谢您参与我们的节目哈。The very first question is that I noticed that you have been one of the oldest working staff from the emergency center who has been working on the front line of combating the epidemic. So what has made you decided to do it, to continue to work on it? 您现在是这个整个单位当中哈，在一线上年纪最大的一位，是什么让你决定一定要来参加这样的一个战役？
这个我觉得现在目前武汉市发生了这个重大的公共卫生事件，我觉得我作为一个一线的一个医生，这个时候就不能想什么年龄最大不最大了，就应该这是一个医生的责任。
She said that it's not about age. It has nothing to do with her age, since it's an epidemic outbreak. It's her responsibility to come back to the front line and do her job. 您继续说。
我没听懂您说的。啊？哦，我没听懂您。
没事，您继续说。您继续说。
哦，刚才
还是那个问题。
就是现在就是我们国家呢，就是我。
Because she's a little bit nervous and because of the protective gear and clothing, it's hard to breathe. OK， 那现在哈，这个火神山跟这个雷神山也快竣工了。您对这两个新修的这个医院有什么自己的看法？是不是对您来说，特别是对整个医务工作者来说，是一个很好的一个解压，就是很好的帮他们减少了这样的一个压力跟负担。I was asking if the construction of these two new facilities help relieve the burden of the current 23 designated hospitals in the city, and what does she feel about it?
在目前武汉出现这个卫生事件的时候，我们武汉迅速采取了一些那个组织了。建了那个火神山和雷神山2家医院，我想在一定的程度上，一定可以缓解那个武汉市的那个这个典型肺炎的那个这个医疗那个资源的那个紧张程度，这个病人有更多的可以去看病的出去了，他们应该是可以得到很好的救治。
Yeah, she said that the medics in Wuhan has been describing about the overcrowded hospital and the lack of the medical supplies. So the construction and the completion of these new facilities will largely help alleviate the burden of those 23 designated hospitals. Okay, thank you very much. 谢谢您. Okay, then a little bit more about this ambulance. It is a very special one. Technically, I'm not 100% sure about the terminology. It is called the negative pressure ambulance. Why is it? Because the system here, what is called the negative pressure system, is able to ensure that the air within this van, the temperature and also the air pressure is lower than that of the outside. In other words, all the air we exhale from us, from the medical staff and from the patient will be immediately taken away, being disinfected by this system before it was released to the outside world. And also, this very special design of the ambulance has been embedded with a lot of medical equipment that's with cutting-edge technologies. For example, this one, you can take a look at this. Oh, sorry. This monitoring machine. It can be used to monitor the patient's body conditions, like their body pressure, the blood pressure, their blood oxygen level, as well as the heartbeat. At the same time, it is able to work as what is called AED at the same time. And also here, this is, sorry, Dr. Jing. Yeah, this one is a portable breathing machine. So you can take it wherever you go with the patient. And also here, there are some very special like ultraviolet lights for disinfecting the environment after the patient gets off the van. So right now, the hospital of Huoshenshan Hospital has been taken over by the People's Liberation Army on Sunday morning. Currently, 1,400 military medical personnel has been evaluating the environment of the hospital, their working environment and treating environment. And they are trying to figure out, have a very thorough understanding of the facilities of the hospital, so that to figure out when and how they're going to transport those 50 patients from different hospitals across the city to Huoshenshan Hospital. And also who they're going to transport, and that's the decision. We cannot really make a decision to find out why. But yes, indeed, we were there at Huoshenshan Hospital, and from what I saw, that the hospital is ready to take in their very first batch of 50 infected patients, mildly infected patients. And the beds are available, like pillows, sheets, covers, and also the hospital dresses are available. Of course, there are medical equipments and also the oxygen equipment systems. And there's a very special ventilation system embedded in Huoshenshan Hospital, that all the air within the hospital wards will be filtered and disinfected. So I'm 100% sure that all those 50 infected patients will get well treated there, and I hope that they will recover soon. Yes, this place is I'm very excited about that. And later on, And some patients from the central hospital of Wuhan will take this ambulance and go all the way from there, about 40 minutes drive to Huoshenshan Hospital. And let's take a bit outside. I think 我们到了是不是? Yeah, I think we have already arrived the central hospital of Wuhan.
估计是要等，
Okay,
估计是要等，
So-
稍等一下。
okay. Because right now we have to wait for the patients to come inside. Yes, 可以
可以说话是吧？
可以说。
我觉得我刚才说的。
Okay. As you can see right now, the beds here, chairs, and these two medical devices are supposed to be covered with this to prevent it being infected by the patients, the virus carried by the patients. Since they are not yet there, they are not yet here, so I took them off to show them to you guys. And since they're about to come over, we have to cover them to protect them. And look at us. This is pretty much your first time to wear such a very tight, protective clothing and wearing this mask. And it's a little bit hard to breathe right now. A teeny tiny little bit uncomfortable. Look at it. I mean, I'm completely sealed, except my head, of course. Completely sealed in this suit. We've been here for about more than a week. It's not easy for us to come over here. Some of my colleagues come here by flying to the capital city of Henan province, Zhengzhou, and then they ran a van and drove all the way from Zhengzhou to Wuhan. And some other colleagues of mine just took the bullet train all from Beijing to Zhengzhou, and then they continued to go southwards and then get off in Wuhan. And take me myself, for example, I'm apart. So I took the train from Changsha, the capital city of Hunan province, and go all the way north to the destination of Zhou, but I stopped over in Wuhan. So this is how we managed to get into the city. And as I just mentioned, that lots of medics in Wuhan arrived of the medical supplies, but now the problems of the shortage of medical supplies have been largely alleviated. The pressure have been largely alleviated, but 能听见。回来了，有了。好，可以开始了吗？Okay, now measures have been taken by many hospitals to cope with the problems of overcrowded hospital working environments. I know that many of those designated hospitals have been converting their common hospital wards into temporary ICUs and to try to host more patients. And also, I visited Tongji Hospital that has been introducing, which has launched the online outpatient service that that the people can communicate directly with the experts from the hospital, so as to reduce the risks of cross-infection. Why is that? We know that right now is winter time. It's also a flu season, so many people got cold and fever. And as their body temperatures go up, they thought that they might get infected by the new virus. Then they rushed into the hospital, which are already crowded because of the outbreak, and that highly increased the risk of further infection. So this online outpatient service enable people to, communicate with doctors at home without, going to the hospital, staying in the queue, in the line, waiting for several hours. There, they can get advice from the 400 hospitals from the Tongji Hospital. If they just got ordinary cold and fever, and they might get suggested to stay at home under home quarantine. If they have very suspicious cases, then further instructions will be given by those doctors online to help them what to do. So that saves a lot of time, saves a lot of energy, and largely reduces the risks of cross-infection. And yes, and also the number of cases in another city in Hubei province, Huanggang, is only second to that of Wuhan, and together with another city of Xiaogan, Huanggang and Xiaogan, the two cities, with a combined population of 12 million, has already taken 11%, more than 11% of the global infection and death, especially the city of Huanggang, with reportedly over 570 confirmed cases of infection and more than 12 deaths. It's particularly severe. So right now the city of Huanggang has been locked down, and the local authorities announced that each one of the household can designate only one people to go out to buy food, water, whatever, just only one people for each household. So measures have been taken by the local government to control the spread of the virus. Yes, it is a very difficult moment, but medics have been working very hard to combat the epidemic. Now I think we still got some time. We haven't really started our journey. 金老师，我们是什么时候出发还不确定。Okay. It seems like we still have wait for another 20 minutes to get off. So, 金老师，我们再聊一会儿。Shall we talk a little bit more? So, how long have you been in the front line of combating the epidemic? 您在这个抗击疫情第一线已经有工作多长时间了？
我工作了27年了，已经。
目前这个疫情已经工作直到多少天了？
多少天了？从疫情开始的时候，我们就一直随时待命，已经。
Okay, she has been working in this as a medical worker for 27 years, and she has been working day and night without any break since the outbreak of the epidemic. Have you ever really panicked when the epidemic just occurred, when the outbreak was noticed? 就是当这个疫情爆发的时候，你是不是会当时有没有感到害怕？
这个来不及害怕呀，不能去害怕呀，这肯定就。
She said that she doesn't have much time to panic, and she cannot panic either. 为什么？
这个时候国家出现了这个重大那个疫情的时候，我们不是个人利益了，这已经是应该是把这个人的小事都是小事，应该是把就是人民群众的那个健康啊，把他们放在第一位，所以其他的事情都来不及去考虑。
She said that it's not about herself, it's not about an individual issue. It has a lot to do to the future of the country. So she has to, stand out and go to the front line and continue to work combating the epidemic. But have your parents and your family really worried about you during this very special period of time? 就这段时间，你的家人啊、你的父母啊、孩子们、爱人有没有对你特别担心？
这个有的。我的爸爸妈妈每天都跟我视频，要我要保护好自己，然后也在这个时候要好好工作。
The parents communicate with her every day, like video chat, to check on her if she's still safe and work well. Yes.
接着说。
继续说。
我们自己家里的一些事情，我作为一个年龄在一线年龄就是比较长的医生来说，必须冲在前面。我自己也有信心，我有信心，我们中心也有这个能力，这一定能够在这次抗击那个疫情的之中，一定能够胜利。
She said that she's one of the eldest staff in the emergency medical center, and she has to go to the front line and work as an example for the rest of the colleagues. She is quite confident that the city of Wuhan and the entire country will be able to win this battle against the epidemic. 那您当时是怎么来安慰你的家人，让他们不要太担心？ What did you say to your parents and to family that you don't have to worry, I'll be good?
这个时候有时候要有一些善意的谎言，我就跟他说，我这里就是我要跟他告诉他，我们这个疫情让父母不要太担心，跟他说疫情不要那么严重，免得引起一些恐慌。我说我们这里我们在工作的时候挺好的，单位的领导就是给我们一些防护措施都是做到3级防护，首先要保护自己，才能够保护就是人民群众的健康嘛，这个时候就不能给大家添乱了，所以我就是经常就跟我们自己的父母、我的孩子、我的家人说，请他们都放心，我的很好。
Okay, and she said that she's been telling her parents and her family that the emergency center has been taking very good care of her, and protections measures have been done every time when she go to the front line to work with those patients, so they don't have to really worry about that. 那现在这个疫情您是怎么看的？ What do you think of the epidemic situation right now? Will it getting worse, or will it get bad, or getting improving, or getting better?
目前的这个疫情，我觉得是我们有信心、有能力来去打赢这场战争。我们大家要做好自己的个人的防护，包括就是要相信科学，不信谣、不传谣，自己的保护自己才能保护别人。
She said that the first thing that we need to protect ourselves, and so as to protect other people. But I saw some people on the street the other day that they are not wearing masks. I was really worried and I was kind of shocked. So what would you say to the citizens and even the all Chinese people that what should we do to protect ourselves? 我看到街上有些人都没有戴，甚至都没戴口罩。那您觉得我们在这个自我保护上，非常关键的是需要注意些哪些地方呢？这个
疾病肺炎主要是呼吸道的传染病，所以我觉得首先从戴口罩那个病从口入这一块要呼吸道戴口罩，然后再勤洗
So
手，
wearing mask is very important.
勤洗手，戴口罩，
And frequently wash your hands.
就是少串门，就是不聚会、不聚集。我也是这样告诫我周围的朋友、亲朋好友都是这样。首先把他们不要给大家再添乱了。
Just don't go out and don't visit your friends. Don't, like gather together for whatever reason. Just, stay alone at home under home quarantine. Okay, thank you very much. 非常感谢. I'll talk to you later. 好，我这边不需行好 OK， 我们能不能先切断一下？ Probably because of some coordination work between the 你告诉我倒数吧。准备开始。Okay, now we are back again at the emergency center of Wuhan, and we don't know why we haven't really started our journey to the central hospital of Wuhan, probably because of some coordination work between the emergency center and the Huoshenshan Hospital. And as you can see right now, there are 3 ambulances waiting to go to the hospital to pick up those infected patients and take them to Huoshenshan Hospital. And except from the 2 new facilities in Wuhan, the Huoshenshan Hospital and the Leishenshan Hospital, there are 2 more hospitals the Chinese authorities have plans to build in the nearby city of Huanggang and Zhengzhou, a city about 300 miles away from Wuhan. So it is, building a hospital from scratch within a week or within 10 days is not the first time in China. Back in 2003, that Chinese authorities built the Tangshan Hospital in Beijing in just 7 days to respond to the SARS epidemic. It treated 1/7 of all of the country's SARS patients at the time. As you can see now that the working staff of the emergency center just came back and busy with coordinating with the mission of transporting the infected patients to Huoshenshan Hospital. We have been delayed for several times. Again, we were there during the daytime at Huoshenshan Hospital. Everything is ready. Hospital wards are all set. Medical equipment are ready as well. So just waiting for those patients to arrive. Now right now, Wuhan, the city, the largest city in central China, has been locked down for more than a week, and that has prompted people to rush to supermarkets to stock up food like instant noodles, vegetables, and whatever they can put their hands on. But there hasn't been an acute shortage of food because China's biggest vegetable production base, Shaoguang City, in the eastern Shandong province has been asked to deliver 600 tons of fresh vegetables to Wuhan every day in the next 10 to 15 days. And also China Grain Reserves Corporation Group have stepped up supplies of rice, meat, and cooking oil to Hubei province. Those medical workers here at the emergency center, as you can see, are still doing preparation works for taking those patients to Huoshenshan Hospital. Now, leading Chinese epidemiologist Zhong Nanshan said additional hospital space was very crucial to stopping the spread of new infections. He said that the lack of hospital rooms forced sick people to return home, which is extremely dangerous. So having additional beds available is a great improvement. As a result, the new facilities, including Huoshenshan Hospital, will be able to largely help alleviate the burden of the current 23 designated hospitals in Wuhan. Now you're watching live coverage of CGTN on the mission of transporting 50 infected patients to Huoshenshan Hospital. It's approaching 9 o'clock at night. Lights are on. It seems that we're about to start our mission very soon. We're still waiting for the command from Huoshenshan Hospital. There are in total 10 ambulances tonight for the mission. 2 of them will go directly from Tang Hospital to Huoshenshan Hospital, and the rest of the 8 ambulances will start from here, the Emergency Medical Center of Wuhan. Then they go to different hospitals, pick up those patients, and then send them to Huoshenshan Hospital. As you can see right now, there are 3 ambulances still waiting for command at the emergency center. The rest of the 8 ambulances have set off to other hospitals. (1,400) medical workers have now busy working at Huoshenshan Hospital, and they worked very hard to evaluate the working environment at the hospital. Now it seems that we don't know what's happening right now. We're still waiting for the command. Yes, again, the medical workers at Huoshenshan Hospital has been evaluating the working environment at Huoshenshan Hospital. That took some time to decide when and how the patients should be transported there, because the virus could be fatal. We should be well prepared before we set off.还不知道什么时候走是吗？
他现在是通知了我们是汉口医院先走，走了之后可能是过半个小时之后我们再出发。
所以我们现在是几点出发 ？When shall we go？
具体时间还不知道，现在。
We don't know yet。我们还不知道具体时间。
对。
Okay. We still don't know when we can leave for the hospital, the central hospital of Wuhan. Yeah, I'm right now at the emergency center of Wuhan. And, used to be 6 platforms, calling platforms, dispatching platforms. But now they have added 9 more dispatching platforms to receive the calls from the citizens and help them to cope with the epidemic, to take them to hospitals. And a lot of administrative staff here with medical background have also been assigned to work here to help with dispatching jobs, and also many other workers from the medical teams and the rescue teams across the country have been assigned, have been dispatched to come over here to work with them. And 50 more hotlines will be soon launched, set up to receive more calls from the citizens. So from here, a lot of more measures have been taken to help those citizens get in touch with the hospital, with the ambulance, to take their families suspected of getting infected and take them to hospitals. And right now, Huoshenshan Hospital is complete with 1,000 more beds for the city. So that's a really good news for the infected patients of Wuhan. And 2 more, as I just mentioned, 2 more hospitals, new health facilities will be built. One in Huanggang, the city that has the number of cases second only to the city of Wuhan, and the other one is quite likely to be in the city of Zhengzhou, the capital city of neighboring Henan province. And you are watching CGTN live coverage on the mission of transporting 50 infected patients to Huoshenshan Hospital. Since right now we don't know when we will start the journey, so stay tuned. We'll come back later.
您是哪个经历的？
Welcome back to CGTN live coverage on the mission of transporting 50 infected patients to Huoshenshan Hospital. And we're still here at the emergency center of Wuhan waiting for the order from the city authorities to go to hospitals, in particular the Central Hospital of Wuhan, to get the infected patients and send them to Huoshenshan Hospital. And right now, since I'm here and not having a very close contact with the patients, so please don't mind that I took off my protective glasses. And also, I've got some questions from our audiences, and I would like to answer those questions. And the first one is that how many ambulances are here? Well, as I just mentioned, there are in total 10 ambulances, and 2 will go directly from Jingtan Hospital, one of the 23 designated hospitals in the city, all the way directly to Huoshenshan Hospital. And there are other 8 ambulances staying here at the emergency center. As you can see behind me, there are 3 remaining, and the rest of the 5 ambulances have already set off to other hospitals in the city, and we are still waiting for the order from the authorities to go to the Central Hospital of Wuhan to pick up the patients. So in total 10 ambulances, all of them are negative pressure ambulances, and 2 from Jingtan Hospital and 8 from here, the emergency center of Wuhan. And the second question is that when will the patients get on board, and can we see those patients? We don't know exactly when, because we're still here waiting for the instructions of the city authorities. But as soon as we get to the Central Hospital of Wuhan, we will show the footage of them get out of the hospital and, get into our ambulances. So don't worry about that. Just stay tuned with us. And the third question is not a question, saying that we've been working very hard. Thank you very much. And it might be quite uncomfortable staying in that van. Yes, indeed. It's very, even though it's winter time, but putting on such a protective gear and clothing, it's kind of completely sealed. So it's quite hard, actually. And also saying that if the one ambulance can host 5 mildly infected patients and 1 severely infected one, well, actually, each one of those ambulances is supposed to take only 1 severely infected patient, since the mission today is about sending 50 patients by 10 ambulances to Huoshenshan Hospital. So I think each one of those ambulances will take more than 1 patients. And as far as I know, today all the patients that we're going to pick up are mildly infected. So their body conditions are relatively fine compared to those severely infected ones. And yes, the other one made some comments saying that there will be no cross-infection in this negative pressure ambulances because we have this very special ventilation system that exhausting air that we exhale in the van and take them out immediately and get them disinfected before it was released to the outside. And also we have questions saying that where do all those medical workers come from for working for the Huoshenshan Hospital, another new health facilities? Well, are they coming from the military as well? No, they are not coming from the military. Those who are going to work at the Huoshenshan Hospital are not from the military. But where do they come from? I cannot answer that question right now. But I'll try to figure it out in our following coverage of the combat against the epidemic. So, so another one saying that should I go inside? Asking me to stay safe. Thank you very much. Yes, my colleagues, my cameraman who is right now holding it, and he's going to stay with the ambulance all the way from the Central Hospital of Wuhan to Huoshenshan Hospital. And since I cannot take too many spaces in the van, so I have to get off, saving more space for those patients in need. So we should say keep safe, my cameraman, Yu Chuan. His name is Yu Chuan, and he will go all the way from the hospital to Huoshenshan together with those patients. But don't worry, he's well protected with so many protective clothing and gear. Glasses, masks are well put, and gloves and shoes protectors, so don't worry. Now, since we're still waiting here, we haven't got the exact time to set off, so let me show you guys around here. I'm gonna take you to the dispatching center of this emergency center of Wuhan. That's a very large space. From there, we can have a better understanding how the city authority has been dealing with those incoming calls and needs of those people whose families are kind of infected. They need help from this dispatching center to get ambulance to their homes and take their family members and go to hospitals. This is the first floor. We need to go to the 8th floor. Since we're going to take the lift, the signal might be not so good, so please don't mind if you lose us. Okay, we have been spending almost the entire day here at the dispatching center of the emergency center. I was very impressed by the efforts that's being made by the working staff here. We have been working very hard, but they are working day and night in only 2 shifts, only two different shifts. So it's even harder for them. As you can see right here, this is the more than 50 hotlines that's been newly set up for receiving the calls from the citizens in Wuhan. When I come here in the morning, nothing is here, but look at the progress they've made. Rapid progress. It's set up right now, so available for incoming calls from the citizens. And let's keep moving. Yes, actually, this is just like a meeting place of the dispatching center. Has been turned into a hotline zone. And this is the dispatching center of the entire emergency medical center of Wuhan. As you can see right now, the dispatchers are busy working here. There used to be only 6 dispatching platforms, but to cope with the help cope with the epidemic, the authority added 9 more dispatching platforms, receiving calls from the citizens, and including some of the administrative staff, as I just mentioned, with medical background. They have also been assigned to work here to help those dispatchers to receive calls. Now they are just receiving a new incoming call. Just from their communications, we can, get a lot of stories, sensing the anxiousness and nervousness of those families who are needing help from the city authorities to help their family get treated and find a hospital to stay. But the measures have been taken by the local government to cope with the problems, the new health facilities, and also the measures to ensure the food supplies, etc. And as you can see here, there's a big screen showing lots of statistics relating to the dispatching work of those ambulances. Right in the middle, as you can see, 绿色的那个城区图, I can see this is a map of the downtown Wuhan. There are many green spots there. Each one of the green spots represents one emergency stations. There are in total more than 70, nearly 80 emergency stations in downtown Wuhan, and we're here at the very center of all those emergency medical stations. This is like a headquarters. And also there are many other numbers up there. There are numbers like 3,276, 3,276. That's the number of the calls that have been calling and being received by the dispatchers. And also the other number is 459. See if you have seen it. That's the number of the mission that has been successfully conducted, the dispatching mission. And there are also numbers collected for those unsuccessful. Not unsuccessful, is that maybe they didn't manage to get the patient, or the patient was just in an ordinary cold or fever. That number is 226. And we have the number for those who have been well treated and sent to hospital for further treatment. That number is 651, 651那个. Yes, that's the number. And here, this map shows the locations of all ambulances that has been sent out. As you can see on the right side, there's a number 4, 4的数字, number 4. That means the number 4 ambulance location in downtown Wuhan. And the other side, here, there's a list of the ambulances that has been on the mission or standing by or available for dispatching. Red ones means those that has been dispatched on their way to pick up the patient. And the yellow one means that has been standing by on their way. And the green ones means represents those that are standing by in the emergency center or emergency stations. Another audience has just raised a question saying that why so many patients if it's a self-eliminating virus, and why the need for new hospitals? Well, since it's a novel coronavirus, it's completely new, we haven't had a really thorough research on it. So the experts are not 100% sure that if it is a self-eliminating virus with the rise of the temperature, just like the SARS. And also, why the need for new hospitals? Well, since there has been an increasing number of patients, all those 23 designated hospitals with the capability of treating this new pneumonia is inevitably getting more and more crowded. So we need more health facilities. So for now, we have two in the city of Wuhan. One has been complete, that's Huoshenshan Hospital, and then the other one is Huoshenshan Hospital, which is still under construction and is expected to be operational on February the 5th. And there will be 2 more, as far as I know. One in Huanggang, another city in Hubei province with the number of cases second only to that of Wuhan. The situation there is getting very severe. So we need one more there, and the other one is quite likely to be set in Zhengzhou, the capital city of the neighboring Henan province. Now we are at the same time having the live broadcast on a routine press conference over the epidemic situation by Hubei province provincial government. So we can take a look at that and stay tuned with us too, since we're still waiting to start our journey to the central hospital of Wuhan to get those patients and send them to Huoshenshan Hospital. Stay tuned. I'll see you later.
这个抽检车往那边所有都用100多个，我担心到真正接送的时候电量不够。行，那我是直接停掉抽检车。
喂，好。
Hello and welcome back again on CGTN special coverage on the mission of transporting infected patients to Huoshenshan Hospital. I'm Tang. Now I'm going to answer some more questions from our audiences. The first question is that is Huoshenshan Hospital only receiving those severely infected ones? Well, that's not true. All those infected patients will be able to get to get the chance to go to the Huoshenshan Hospital. The only difference is that the Huoshenshan Hospital does not have an outpatient service. So if you want to talk to the doctor to find out what kind of disease that you've got, you need outpatient service, you have to go to the rest of the 23 designated hospitals across Wuhan. When you get confirmed as infected by the new virus, then you will get a chance to send to Huoshenshan Hospital. And it is open to all infected patients, no matter it is a mild case or a severe case. And the next question is about have any of the patients' health have improved? Yes, lots of patients have cured and left hospital. There have been so many reports on their being cured and leave the hospital, and I'm very happy to see that. And you know that the medics in Wuhan across the country have been working very hard to cure them. You know, we have been talking so many times about the mild cases and severe cases. Why is it called a mild case? It's because that the mildly infected patients have relatively stronger immune system than those severely infected ones, especially those elder ones. So their body conditions allow them to cure and kill those viruses by themselves, which is a little bit necessary additional medical treatment. They can do that, so they are also advised to stay indoors and take a home quarantine. So all the major causes of those death cases are not only because of the infection of the novel coronavirus, but also because of those infectious complications that leads to the failure of organs. So together with the failure of organs caused by the infectious complications and the infection of the new virus, that's all the major causes work together to cause the death. And the third question is about what kind of medicine Chinese doctors are practicing to treat affected patients. Well, yes, sorry for my poor knowledge of epidemiology. I don't know the exact terminologies for the medicine, but I can assure you that the Chinese doctors are working on the new medicines, and they have made progress, including the production, including the development of the new vaccine for the virus. And another question is about asking if the hospital is 100% completed. Well, it was handed over to the People's Liberation Army on Sunday morning, but it is not 100% completed. I was there in the morning. The constructors are still working on paving the way and installing some of the medical equipment, internet, water, electricity, etc. But for what they have got there, for now, the facilities and hospital units and medical equipment they've got there are able to host the 50 infected patients today. So you don't really have to worry about that. But it takes a little bit more time for them to be able to, be complete 100% and be able to offer 1,000 beds for all infected patients around the country. And also, the Huoshenshan Hospital is about to complete it. So we'll have like 1,500 beds, more beds for the infected patients. And the last question is about why so many patients if it's a self-eliminating virus. I think I answered that question already. What the need for new hospitals? Again, since it's a new coronavirus, we don't have a very thorough research on it. We are not 100% sure if it is a kind of a self-eliminating virus. So we still have to be still cautious about it. And that's also part of the reason why we need these new hospitals, with some particularly designated design and special medical equipment. We can collect like one first-hand information about treating the patients, and that's going to help with us develop new medicines and vaccines for fighting against the new coronavirus. So that's pretty much all for this round of Q&A, and we're still waiting here to go to the Central Hospital of Wuhan to pick up those patients, but we haven't got the command from the city authorities, and we're still waiting for their final instructions. So just be patient, stay tuned with us. I'll let you know as soon as we get the order to start our journey. And I'll see you guys later.